Well, Mr. President, we find ourselves in yet another Alice in Wonderland moment here in the Senate. Again, we're on the brink of a government shutdown for no reason other than the House Republicans' absolute obsession with repealing the Affordable Care Act. Now, their strategy isn't anything new. They're running the same old plays out of the same old playbook that they've used for 3 years. Now, mind you, none of these attempts have worked, but failure is no deterrent if all you care about is scoring political points with your political base. 42 times, Mr. President, 42 times the House has voted to repeal or defund the Affordable Care Act. You'd think after the first 41, they might get that it's the sense of it, that it's just a waste of time. But no, the House is at it again, risking the widespread economic damage that a government shutdown would cause, just so they can indulge their political obsession yet one more time. I sort of half facetiously said this last weekend that the good news is that obsessive-compulsive disorder is covered under Obamacare, in case these House Republicans might care to use it. Defunding the Affordable Care Act would deprive Americans of all of the law's benefits: historic consumer protections, affordable coverage, and cheaper prescription drugs, just to mention a few. Work on the insurance marketplaces, which open for business, as we know, next Tuesday, would stop. As a result, individuals and small businesses would no longer be able to enroll in affordable, comprehensive health insurance through the marketplaces, nor would they receive possible tax credits to help them with their premium payments. In addition, the planned expansion of Medicaid would be canceled. 7 million Americans who are projected to enroll in the marketplaces next year, and 9 million through expanded Medicaid would lose their coverage. Over the next decade, the number of uninsured would rise by at least 25 million Americans. Now, as if 25 million more uninsured weren't bad enough, this bill from the House would cancel all of the hard-earned, long-awaited consumer protections that's in the law to protect every American with insurance, like coverage of pre-existing conditions, coverage of young people on their parents' policies to age 26. So we'd kind of go back to the bad old days when insurance companies were in the driver's seat, telling you what kind of health care you're entitled to and when, and charging you outrageous prices for it. Instead of protecting all Americans against arbitrary limits on coverage, repeal of the Affordable Care Act would take us back to the days when insurance companies could terminate your illness just when you're the sickest. This would hurt families like Danny and Lisa Grassoff from Texas, who were unable to find coverage that would pay for their son's hemophilia treatment until the Affordable Care Act banned lifetime limits. More than 105 million Americans are currently protected by this provision. 105 million Americans protected. That's under the Affordable Care Act. Instead of allowing young people starting a new job or new business or going off to school to stay on their parents' policies until they're age 26, which they can do now under the Affordable Care Act, repeal would make them fend for themselves in a chaotic insurance place that offers too little coverage for too much money. More than 3 million young Americans are currently covered and are taking advantage of this protection. 3 million. They would lose it under the House bill. Lose it. All 105 million Americans protected from a ban on lifetime limits would lose it under the House bill. Now, instead of protecting 130 million non-elderly Americans who have a pre-existing condition, like high blood pressure, diabetes, heart disease, from denial of coverage, repeal would put insurance companies back in the driver's seat, picking and choosing who they want to cover. 130 million Americans right now covered under that ban on pre-existing conditions. Instead of helping all Americans prevent illness or disease by providing free preventative services like mammograms and Colonoscopies. Repeal would allow insurers to charge expensive copays, sometimes as much as $300 for these essential services. Right now, I just talked to a friend of mine who recently went in for his annual checkup, got an annual checkup, got advice on how he should handle his health care. No copays, no deductibles under the Affordable Care Act. Repeal under the House bill would deprive states and localities of vital funding to combat chronic diseases like cancer and diabetes, heart disease. Thanks to health reform, the Prevention and Public Health Fund is saving lives and cutting costs by supporting such programs. And cutting off funding would immediately stop states' work building the health insurance marketplaces that I just mentioned, which start up next Tuesday. And these will be transparent, easy to understand, one-stop shops where individuals and small businesses can purchase affordable coverage. Starts next Tuesday. Now, these marketplaces have been endorsed by experts all across the political spectrum because they will create for the first time a real marketplace for health insurance, where individuals and small businesses have the same purchasing power and choice that only big companies enjoyed before. And again, this will have a direct pocketbook impact. Premium rates are coming in for marketplaces across the country, and they're much, much lower than projected. In fact, my home state of Iowa released rates last week that independent experts say are some of the lowest in the country in the marketplace. Well, the House bill would take that away, would stop that. Why would we want to do something like that when we're providing a really good deal for consumers? Most importantly, these exchanges are a centerpiece of a system that will bring coverage, as I said earlier, to more than 25 million Americans who otherwise would be uninsured, living with the oppressive fear of being one illness away from bankruptcy, or not knowing if they can afford a doctor visit for their child. So why would anyone want to stop this? Why would anyone tell states, stop what you're doing to serve your citizens? But that's exactly what the House bill does. If we pass that House bill, Congress will turn its back on America's seniors, tossing out hard-won improvements in Medicare benefits. It would take us back to the days when Medicare prescription drug coverage had a giant gap. We all know that as the donut hole in the middle, exposing millions of seniors to the full cost of drugs just when they need the most assistance. Now, health reform closes that donut hole step by step until 2020, when it all disappears. Now, I just received this from Iowa, Mr. President. Already, the Affordable Care Act in Iowa, seniors on Medicare saved, listen to this, seniors on Medicare saved $76 million on prescription drugs because of the Affordable Care Act in Iowa. Just in Iowa, $76 million. You adopt the House bill, takes that away, reopens that donut hole. 6.6 million seniors all across the country have already saved more than $7 billion in discounts on drugs purchased in the donut hole. Now, repealing this would increase seniors' drug prices by $5,000 a person over the next 10 years. Why would we want to do that? The House bill will roll back the unprecedented investments that we make in Medicare fraud prevention. Now, this is another little-known aspect of what we put into the Affordable Care Act. We increased criminal penalties. We launched innovative new technologies to detect and pursue fraudulent activities. We put more cops on the beat to preserve Medicare funds for beneficiaries, not the quacks and the fraud manipulators. Taxpayers of this country save $8 for each dollar that we've put into that program. You put $1 into it, we're saving $8. Now, why would we want to repeal that? But the House bill would repeal it. It would hurt seniors' access to health care in rural areas. I come from a rural state. The occupant of the chair comes from a very rural state. And we put in the Affordable Care Act incentive payments paid to rural primary care providers in the Affordable Care Act. House bill, take that away. In the Affordable Care Act, we put provisions in there, as I mentioned kind of earlier, for seniors to get preventative care and wellness visits, preventative services. No co-pays, no deductibles. In 2012, more than 34 million American seniors got free preventative services in Medicare. The improvements we put in the Affordable Care Act to Medicare payment policy, coordination, and efficiency that CBO tells us will extend the life of the Medicare Trust Fund by another decade. Republicans are always going on, well, Medicare's broke, it's going to go broke, it's going to go broke. Okay, in the Affordable Care Act, we did things that the experts say will extend the life of the Medicare Trust Fund by yet another decade. They want to repeal that. It kind of doesn't make sense, does it? It just doesn't make sense. Finally, Mr. President, we come to the most inexplicable part of this debate. Republicans have played the Washington stage politically for all it's worth. We saw an example of that last night when one of our colleagues on the other side kept the Senate in all night long. I think the distinguished senator from Texas started off yesterday afternoon around 2 o'clock or something like that. You'll excuse me if I didn't pay a lot of attention to it. But anyway, he started around 2 o'clock in the afternoon. Went on all night, kept the Senate here, went on this morning until about noontime, I guess. Well, I respect every senator's right to come to the floor and to speak unhindered, just as I'm doing now. And pretty soon another senator will speak unhindered. That's one of the beauties of the Senate. But I think we also have a responsibility to be at least a little cognizant, just a little bit, of how we're burdening others. So yes, a senator spent all night here. I wonder if that senator ever stopped to consider how much it costs the taxpayers to keep this place lit, to keep the clerks and the people here, all the police, all the safety people here and around outside, just to keep this place running, just so one person could speak all night. I wonder if we ever considered that. Like I said, I don't deny anybody's right to speak, but you have to wonder about responsibility, being responsible to the body and to the public at large. Imagine my surprise when that same senator who kept people here all night, kept the lights lit, cost the taxpayers I don't know how many hundreds of thousands of dollars at least. Imagine my surprise when he voted for the very bill he was talking against, the provision. 100-0 vote today. Some things are really hard to grasp around this place, I'm sure the public out there watching this would say, wait a minute, he spoke all night against this bill and against the Affordable Care Act, against Obamacare, threw in a few other things too, but then turned around and voted for cloture on the motion to proceed. So I said, some things are pretty hard to understand around this place. I guess you have to define it in terms of pure politics, sometimes just pure politics. Well, again, here's why I talk about the most inexplicable part. My friends on the other side have been making great and solemn speeches about the debt and the deficit, warning us, bringing us within hours of a government shutdown, all in the name, they say, of fiscal discipline. But as a condition for agreeing to fund the government, what do they want? Repeal one of the best deficit-cutting measures we've ever passed. The nonpartisan Congressional Budget Office confirmed that the Affordable Care Act reduces the deficit by more than $100 billion in the next 10 years and over $1 trillion in the next 10 years. So again, let me see if I get this straight. The Republicans propose to reduce the deficit by increasing the deficits. Well, again, as I say, some things are just kind of hard to understand around this place. So I think it's time to stop the silly games. We had our debate. We worked hard on the Affordable Care Act. So this debate's not about deficit reduction. It's not about the nation's fiscal health. It's just about tearing down health reform at any cost. Tear it down. Get rid of it. Go back to the way it was, when powerful health insurance companies had control to raise your rates whenever they wanted to not give you health coverage if you had a pre-existing condition, to deny you coverage when you got sick, cut you off right at that point, deny you benefits, and making insanely big profits doing so. Well, those are the old days. Seems to me my friends in the Republican Party, well, they want to go back to those days, but we don't. The vast majority of American people say, no. We want to move forward with a health care system that covers everyone, doesn't leave anyone out. Now, again, as I said, it's not based, my friend's obsession with repealing this health reform law is not based on budget considerations. Sometimes I wonder what it is based on. Now, if someone were to ask me, Senator Harkin, do you think this Affordable Care Act is the end-all and be-all, that is absolutely perfect? I'd have to refer them to what I said when we first passed the bill, and it came under my committee, the Health Committee. I said at the time I likened it to a starter home. A starter home. We might have to add some rooms later. We might have to move a doorway here or there. We might have to change some of the designs of this, but it was like a starter home to be filled in over the months and the years ahead, to change with changing conditions and circumstances. And as we learned more, as we went ahead, that maybe things would have to be changed in the Affordable Care Act. But the foundation was solid foundation, and a solid structure of making sure that we had a healthcare marketplace open to all, that it wasn't controlled by a few, that everyone, no matter how poor, everyone would get health insurance. And those who are the poorest would get a government subsidy to buy into that insurance. We wanted to make sure that we had good preventative programs, wellness programs, to keep people healthy and out of the hospital in the first place, to change from what I've always said we had in America. We did not have a health care system, we had a sick care system. If you get sick, you get care. But in America, we've never had much of anything to keep you healthy in the first place. As I've said many times, in America, it's hard to be healthy and easy to be unhealthy. We need to change that around, make it easier to be healthy, harder to be unhealthy. The Affordable Care Act takes steps in that direction, providing these free mammograms and cervical cancer screening and colonoscopies, by providing wellness checkups for people every year, by putting in place community transformation grants so communities could begin to think of how they construct their communities to promote wellness, good activities, better diets. So yeah, it's like a starter home. Do I think some things will have to change in the Affordable Care Act in the future? I'm sure that's true. But that doesn't mean tearing down the structure, digging up the foundation, and throwing it all away, and going back to where we were before from square one. The answer is to move ahead. Let's open up these marketplaces. Let's get people signed up. If things need to be fixed and changed in the future, that's our job here. That's our job, to fix these things and make sure that our laws are correctly interpreted and benefit people. You know, it's like some people seem to have the idea all we have to do is pass the law and sit back and everything will take care of itself. That's not true. No laws like that. We need to implement them. But we need to do it with goodwill and in a spirit of compromise and in a spirit of not everyone knows all the answers, but in a spirit that what we are attempting to do with the Affordable Care Act, or Obamacare, if you will, is to move us in a direction where people will be healthier, where people will have affordable, quality coverage that can't be taken away because they get sick or be denied because they have a pre-existing condition, where kids can stay on their parents' policies for a decent length of time after they get through school. And all the things I just spoke about. These are good, solid foundations for a good health care system in America. So I think, my friends on the other side who want to repeal this are simply on the wrong side of history. I'm always reminded of what William Buckley once said. William Buckley was sort of the father, I think, of the modern conservative movement in America. He once said that the role of a conservative is to, quote, stand athwart history yelling stop. Well, knowing the late Mr. Buckley, I am sure he probably had a smile on his face when he said it. But it seems like that's what some people are saying. We just want to stop all this. Not that I've said many times since we first started the Affordable Care Act debates several years ago and working on this, if people have a better idea, come forward with it and let's take a look at it and see what we come up with. But I haven't seen that yet. So I just want to close by referring to a couple of letters that I just got from Iowans. They make it clear what this is really all about. Angela from Edgewood, Iowa, writes that she has, quote, a family history of cancer, and now I have been able to have the screenings that I need, end quote. She asked me how she can volunteer to spread the word to others. Well, I just did. John from Des Moines says that, quote, because of the ACA, the Affordable Care Act, I have been able to start my own business. I've been able to purchase coverage and am looking forward to the exchanges, end quote. So the choice is to go forward, to work together to make whatever needed improvements need to be made, to come together as a united American people, and to create a reformed healthcare system that works not just for the healthy and the wealthy, but for all Americans. That's what this battle's about, Mr. President. That's what this is all about. And that's why we don't need to shut the government down. Let's act responsibly. Let's pass a short-term continuing resolution without defunding the Affordable Care Act or all this other nonsense dealing with the debt ceiling increase. And then let's get down to the hard work of working together to make sure that we fund the government next year as we bring this Congress, this session of the Congress to a close later in November or December. So hopefully that in the next couple of days, the Senate will act and that we'll let the House know that we're not going to defund the Affordable Care Act. With that, Mr. President, I yield the floor.